Confusion and misinformation can increase the risks women face from breast cancer. Separating the facts of the disease from fiction can save lives. Lorene Cachola has more.
In some cases, what you don't know can hurt you. Yvonne Britton is a breast navigator at the Baptist Women's Health Center. She works with women going through the cancer treatment process and says one myth some women believe is that they're too young to worry.
The American Cancer Society recommends that women that are between the ages of 20 and 30 do a clinical breast exam every 3 years, meaning that they are examined by a physician.
And most doctors still recommend all women should perform monthly breast self-exams. Another misconception is the role of family history as a risk factor. Some women don't think they have to worry if they don't have a family history of breast cancer. And while family history does put women into a higher risk group, most women who get breast cancer don't have a family history of the disease.
People do have that misconception, and it is a misconception. Every woman, just being a female, puts you at risk for having breast cancer.
10 years ago, Donnell Hindelang found a lump in her breast purely by chance.
Well, I was pretty lucky because I just found mine as I was stepping out of the shower toweling off. I wasn't immediately concerned because I had remembered that I had gotten hit in the breast the week before, and I thought it was just a hematoma. Again, I was 40 years old and I was in the best shape of my life, so it was just something to mention to the doctor.
Another myth is that finding a lump in your breast means you have breast cancer. 8 out of 10 lumps are benign, but any change in breast tissue means you should see a doctor immediately. However, many women are concerned what a diagnosis of breast cancer will lead to.
They may think that if I have breast cancer, I'm going to have my whole breast removed. That probably is not the case, especially if it's caught in early stages.
In Hindelang's case, a biopsy found she did have cancer. She got a lumpectomy, followed by 6 rounds of chemotherapy and radiation. In time, her entire breast was removed, but it was something she was able to cope with.
For me, my breasts weren't that important to me. I've been accused of being very confident, more so than probably should be. Not that I'm not obsessed with my looks, and it wasn't a big deal. It was just a surgery.
Unlike Hindelang, some women may avoid the preventive steps they can take, avoiding mammograms because of concern that the radiation is dangerous or will cause cancer to spread. But neither of those things is true.
They need to know that the amount of radiation that is emitted from a mammogram is so small that it does not interfere with healthy cells.
So make sure you separate the facts of the disease from the myths. It's one of the best ways to protect yourself from breast cancer. For Smart Medicine, I'm Lorene Cachola.